get analysis on the medical aspects here. Joining me from London, Dr. James Smith, emergency doctor and lecturer on humanitarian policy, University College London. Great to speak to you, James. The crossing was, as we know, it reopened yesterday. The reopening was delayed. Then a lot fewer people got across than was first expected. As a doctor and one who has worked in Gaza, how do you feel when you know the types of patients and their injuries in Gaza, and you know that really not very far away, because the entire length of the Gaza Strip is only 25 miles, not far away, there is all the medical assistance that they need, and we just can't bring the two together. How does it feel when you know this?
It's infuriating. I mean, I'm enraged, in short. The day that I entered Rafah last in April of 2024, the Egyptian ambulances were lined up ready to receive patients. We knew that that Palestinian patients were being transferred out for urgently needed care. Over the course of the last 2.5 years of this genocide, approximately 200,000 Palestinians have been injured. Many of them are living with horrific trauma-related physical injuries. That's to say nothing of the Palestinians with pre-existing medical problems or new complex medical diagnoses that require treatment that is now no longer available in Gaza. We have to understand Israel's complete control over everything and everyone that enters and leaves Gaza in tandem with our understanding of the systematic destruction of the Palestinian healthcare system. So the Israeli military and the Israeli state have destroyed sovereign health capacity inside Gaza. They've manufactured dependency on NGOs, non-governmental organizations. Now they're seeking to ban those organizations from working in Gaza, deepening the health situation inside the Gaza Strip, while limiting the ability for people to seek care outside. We know that many of the Palestinians that need medical evacuation, they need timely access to comprehensive medical, surgical, rehabilitative, and psychosocial support.
James, I just want to jump in there, because you're talking about the aid they need, and it seems to me a blindingly obvious question is, regardless of Israel's security concerns, what if just equipment, medical equipment, drugs and other things were allowed in? Don't need to bring any people with them. Would that make much of a difference to the medical needs of the people in Gaza?
To an extent, absolutely. I mean, all of these things need to be done. And again, this is not a charitable gesture. These are legal obligations that Israel has repeatedly flaunted. The aid, the material aid that's entering into Gaza at present, the vast majority, more than 60%, is food aid. Now, of course, that's also urgently needed, followed thereafter by shelter. Only 3% of the aid entering into Gaza is medical supplies. Organizations like MSF, for example, haven't had any of their supplies permitted to enter Gaza since the 1st of January. The healthcare system is, of course, struggling to cope. And in addition to all of that, the violence and the ceasefire violations continue. There are more people being killed and injured and suffering under these horrific conditions.
Maybe this is an unfair question, but if you can, I'd appreciate your opinion on it. Somebody is making a decision of who gets to leave, which patients get priority and go at the front of the queue. If you were making that decision, who's in most desperate need? Who needs to go first?
I mean, it's an incredibly difficult process. There are so many people. I mean, the basic principles of triage are that those with the greatest need go first. But there are, on that list of more than 20,000 Palestinians that are known to be in need of medical evacuation, so many should have been evacuated months or years ago. And there's really no reason why this process needs to be limited in this way. 150 patients a day, this is a manufactured process. Israel has prioritized security over the dignity, safety, health, and well-being of the Palestinian people. And that's the story of Palestine since the establishment of the State of Israel.
James, thank you so much for your time. It's always great to get your professional expertise. Emergency doctor, Dr. James Smith, my guest.